My name's Gavin Quigley and I am a consultant neurosurgeon here in Belfast in the UK. I work in a large NHS teaching hospital and we cover the full range of neurosurgery. We provide care for a population of approximately 1.8 million, and they range from neonates right up. Two of us spend at least half our time doing paediatric neurosurgery in addition to our cranial work. We have a very similar setup to many neurosurgical units, certainly in the United Kingdom and in Europe. We don't have an intraoperative MR or intraoperative CT system, which obviously some of the larger units will have, but we have good access to MR angiography, intraoperative ultrasound and standard navigation technology. One of the things we find very useful, the spine's a very good ultrasonic medium. It's essentially a closed box with fluid in it, and you get really good ultrasound images from the spine. And what we've been able to do is, when we're often the preoperative imaging is very clear, shows exactly where the tumour is, but when we try and relate that to the patient's skin anatomy, it's difficult, and you're often a level out, particularly in the thoracic spine. And what we're able to do with ultrasound is to make little windows into ultrasound, and we're able to judge the extent of the tumour and therefore tailor our need for laminectomy, and we can restrict the laminectomy to just the levels we need, and it means that we're able to be clear about where we're actually operating. We've found that there are two cranial transducers really. There's a standard transducer, which gives a nice wide image for procedures such as craniotomy, hematoma evacuation, and then there's a smaller burr hole procedure which allows a standard 12 to 14 millimeter burr hole to be used and to obtain images through that. And both of those can be used in spine, particularly the burr hole probe can be used to make small laminotomies and look into the spine as a small window. I think the advantage of the BK system is it's easy to set up. We've got two specific cranial probes. The resolution and screen image is excellent, and it's very easy to be adjusted in theatre, and our staff are comfortable with the adjustment. And it's also a nice portable design. It fits into a small, crowded neurosurgical theatre very well.